Welcome back, everybody. Hello again. My name's Karen Bath. I'm here with the CEGA team looking after the seminars today. It's my pleasure now to welcome Dr. Chris King, who's here to talk to you about the UK CAA and EASA medical process. I just want to say before I introduce Dr. King formally, we're hugely grateful to him for being here today. We did, if those of you who'd been following us online had noticed, we had a different speaker lined up, but Dr. King has filled the breach for us, so thank you very much for changing your Saturday plans and being here today. The medical topic is pretty complex, so it's really worth having a close listening ear to this, but Dr. King also has some handouts for you to give you a little bit more information, and this presentation is also being recorded, so it will go on our live stream and also on our YouTube for you to watch back at any time, because there is quite a lot of detail to take in. So yeah, pay heed. So I hope you've had a good day so far. This next session, as I say, is all on the medicals. And if I may, just because Dr. King sent me his bio, I'm just going to read it to you to tell you a little bit more about him as an individual. So you know who you've got. So Dr. King is head of the AMC and medical director of Centerline in London and Gatwick, running both medical practices since 2016. Centerline is one of the only two locations providing both EU and UK CAA initial and renewal medicals in the UK. And Dr. King's presentation will guide you through the process in booking and obtaining an EU or UK or both Class 1 medical certificate. So over to Dr. King. Thank you very much.
Right. Good afternoon, everybody. Can you hear me? Yes. We're all switched on. Okay. Okay. Well, thank you, Karen, for inviting me. I was, it's my pleasure to step in, and I've given this talk a few times, and I do feel it's quite important that you understand the medical process because it has big implications for your future. So anyway, moving on, my talk is entitled "The Medical Process for Aspiring Pilots," and I've adapted this for both the EU and the UK medical certificates. And we are based at Gatwick for our renewals and revalidations, and London, where we do the initial medicals. First point is to note that if you are going to have either an EU or a UK medical, that the regulations are different, and they're two separate sets of regulations, although we can combine it in one medical. If you have a UK medical that needs to be sent in for approval by the UK CAA, it has to go to the UK CAA. If you have a European medical, it has to go to whichever country you choose. We work very closely with Austria. So the talk is designed to give you a better understanding of the medical process in applying for an EU or UK Class 1 or an EU-UK Class 3 medical certificate. A quick disclaimer, these views expressed are those of myself and Centerline and not necessarily the CAA or EASA. The content of the talk, I've broken it down. So we've got the application for an EU or UK Class 1 medical certificate, the medical itself, the provision of reports, deferral to the CAA or another country, right of appeal, and what to do if you have any medical issues. The first thing to understand about the medical that you undertake is that it's what we call a regulatory medical. It's not a clinical medical as if you were going to your doctor. We have to satisfy a set of regulations and tick boxes for you to pass the medical, and a lot of people don't understand that it is, as we call it, a regulatory medical and not a clinical medical. And we also have to screen out any medical issues you have and find out whether they have any bearing on any incapacitation that you could potentially have whilst flying. So that's the first important point. And you need to check with your aviation authority or flying school which medical you need, either an EU or a UK medical, or potentially both. We're finding ourselves actually doing more and more joint medicals because some of the flying schools are implementing CAA exams. Some schools are implementing EU exams, and when you qualify, you might have trained at a UK school but get a job with an EU airline. But that's for you to decide. A lot of cadets and people phone us up for medical advice prior to the medical. We're not supposed to give any medical advice prior to seeing you for your medical, as that's deemed a medical consultation, and that has to be recorded formally on your records. But a lot of the information is on the CAA website. If you go on to www.caa.co.uk/medical, you can look up the medical regulations for the UK, and likewise you can find the same regulations, although they'll be interpreted differently by the EU. And you need to check for the initial standards and not revalidation standards. And it's important to remember that you can only have one medical in the EU with one state, although you can now have a UK one as well. So there are three sorts of medicals that we undertake. There's the initial medical, which is the big medical, which we do in London, which encompasses the whole of the medical process and establishes that you have fulfilled all the conditions to be granted an initial Class 1 medical certificate. That certificate will last you 12 months, and at the end of the 12 months you can renew it, and it's called a revalidation, and that medical is far simpler and cheaper. If your medical expires, which you're allowed to do as long as you're not flying, it's classed as a renewal medical. So when you're applying for either a UK or an EU medical, as far as the UK is concerned, they have got a new IT system called SELMA. And what I've done is I have got some handouts here, which is a copy of the email we send people when they apply for a medical. So you could actually take this away with you if you want. And I've also got our cards if needs be. So if you want to come and collect those at the end. But for the UK, you go onto the UK CAA system called SELMA, and then you have to be accepted. You fill in the application form. You have to pay £14 online fee, and then you can actually book your medical with us. This process can take a few weeks, so get it done in good time. And when you come to see us, we then put in the reference number that you've been issued with. We can then bring up your application form, and then we can then proceed with the medical. As far as the EU goes, at the moment it's paper-based, although we are being trained to use their IT system. And if you have an EU medical certificate, that will be issued on paper, which has got Austro Control written on it, although the paperwork may be sent to other countries such as Malta or Denmark. One of the most important things is to get your medical done in good time. Only about 50% of pilots will get their medical certificate on the day. We may require additional reports if you've had any medical issues in the past. Your ECG is assessed by a cardiologist, and if that's not entirely normal, you may need further tests. And if you've got other medical conditions such as asthma, or you've had any depression in the past, or any other medical issues, we've got a bank of medical specialists who can write reports in the format that is acceptable to the authorities to be sent in, and then hopefully you'll be issued your certificate after that. But this can often take weeks or months, and sometimes it can take years. And any costs are extra costs for you, I'm afraid. Because of medical confidentiality, we can only speak to the applicant and not to the family, and that's quite important when parents get anxious about medical situations. We have to be very careful about medical confidentiality, as I'm sure you'll appreciate. And aviation is fraught with delays, so please be patient. So The last point here is you cannot fly without a medical, so get your medical done well before you make your definitive career choices. We sometimes see applicants who come to us in London who are 18, they've done their A-levels, I'm going to be a pilot, can I have my medical certificate please? Oh dear, you've got colour vision problem, can't fly at night, can't have a class 1 medical, or you've had other medical conditions that preclude you from having a medical certificate. So ideally, we suggest that perhaps you get it done after your GCSEs, and then if you do fail the medical, you've still got time to change your A-level choice and your university choice and your career choice. As I've said, there are differences between UK and EU medicals, and the EU may take longer to process your paperwork, as it could be sent to any one of the 27 EU member states, and they interpret the regulations differently. So, booking your medical. Prior to booking your medical, we send out an email containing everything you need to know about your medical, which is the handout, plus the terms and conditions and costs, and we like you to read it and read it again carefully. You can then book your medical. Remember, initial medicals are done at our Area Medical Centre in London and not at Gatwick. And when you come, please make sure that you know which medical it is you require, either a UK or an EU or both. If in doubt, check with your flying school, and you need to understand which syllabus they are putting you through and whether the exams are based on UK regulations or EU regulations. And then if you don't have the right medical undertaken, you may not be able to get into the flying school of your choice, and you may have to come back and have a second medical, which will incur extra cost. So the bullet point for the UK is register on the SELMA system. If you've got any doubt about any medical conditions, and when you fill in the form, the question is, have you ever suffered from, not are you suffering from now, it's have you ever suffered from. If you have had any medical issues, if you go onto the website at the CAA, all the regulations are there, and you can see what it is that applies to you and your medical condition. And it also gives you a selection of flow charts if you have got a medical condition such as asthma, or you've had any cardiac condition, or you've had antidepressants in the past. It tells you what sort of processes you'll have to go through, what sort of reports you require, and also gives you a template for the report that the specialist will need to write for you. On the day of the medical, we like you to allow all day, and you need to bear this in mind when you're booking planes and trains, etc. You need to remember that the previous applicants may have had complex medical problems, and their medical will take longer and subsequently delay your medical. You need to be patient. Remember, you're about to enter a safety critical profession, and the CAA and EASA want to know about your behaviour. AMCs are advised to report any concerns regarding behaviour. Having said that, at the end of the day, if everything is satisfactory, you will receive your medical certificate. So on the day of your medical, arrive in good time, check the location. It's amazing how often people go to the wrong location. You do not need to be fasted. You will need to provide a urine sample, and then your details will be entered onto the online medical record system. We will need passport photo ID, and your names will be recorded as per your passport. Once again, ensure you know which medical you want and that you've completed the SELMA system or the paper system for your medical. When you come in and see the doctor and attend for your medical, We check the paper application form or the online application form. We check your medical history, height, weight and urine, physical examination, just external. Chaperones are always provided for females, and males are offered chaperones. You have a hearing test, a breathing test, a heart tracing, blood test for anemia, blood test for cholesterol. You have a full eye assessment. We've had to purchase exactly the same equipment that you get when you go to Specsavers, and that has to be done on site. So the optometry eye check takes half an hour, 40 minutes. And if you do wear glasses or contact lenses, bring your glasses, and ideally don't come wearing your contact lenses, come wearing your glasses. Your colour vision is tested with the Ishihara plates, the little book with dots in it. And if you fail that, we have an IT program called a CAD test, which fires coloured pixels on a computer screen, and we can assess your colour vision in more detail. We also do a drug and alcohol test. The drug test is urine, and the alcohol is a breathalyzer. And there is also a mini psychological assessment. So on completing the form, as I've said, the questions are, have you ever suffered from? And the sort of thing we're looking for is laser surgery, asthma, previous history of any mental health problems. You need to list your medication, past and present. We look for scars and tattoos. The reason we ask for scars, it tells us you've had surgery. It's not uncommon for us to look at the form and all the boxes are ticked no, and somebody comes with a great big scar on their stomach and we say, what was that? And the answer is, I didn't think it was relevant. If you've got an up-to-date eye report, that's helpful. And when you sign any of the documents or when you sign it off online, you need to remember that it is a legal document and all questions must be answered truthfully. And if you fail to disclose anything, the CAA take it very seriously. In terms of medical reports, we like you to bring any hospital or GP reports to the medical. If in doubt, bring it. Check with your parents about any childhood illnesses you might have had and forgotten. We can tell you what's required after an assessment if you have any medical issues and what the processes would be if you needed further reports or specialist help. With the inception of GDPR, we like you to email reports encrypted if possible. If you have had any medical issues, it's best not to spend any money on reports until the exact requirements are ascertained at your medical. And you need to remember that when we do these reports, they have to be as per the guidelines for either the EU or the UK. And as I've already said, we do have a bank of specialists who are used to giving reports for aviation purposes. We've got cardiologists, neurologists, psychiatrists, chest physician, ENT surgeon. We've got pretty well everything, and we can refer you to our specialists, although you do have a choice of going to see your own. You do have to be careful that using specialists who don't have aviation knowledge, they may not provide the information that we require. And it's not uncommon, certainly for asthma, with the tests that we do, you'll see a chest physician and he'll tell you that it's completely irrelevant and he's not going to do it. In the clinical setting, that might be true. In the regulatory setting, as we've discussed, you have to do it. So you need to be careful that whoever you see understands what is required from the aviation perspective. So, medical valid for 12 months. You can have it renewed up to 45 days before the expiry date. And if you let it lapse, you've got 60 months after the expiry for you to have a renewal rather than a new initial Class 1. So just breaking it down a little bit further, eyes, the initial class 1 requires a consultation with our optometrist, and you can see the visual standards on the website, and it is a full eye check as you go to the optician. We do the Ishihara plates for colour vision, and if you make any mistakes, then we go to the CAD test. For ATCOs, they all have a CAD test. If you have glasses with high refraction, i.e. your prescription has got big numbers on it, we have to get the form completed by an ophthalmologist, and that is sent into the CAA. There are certain eye conditions where we have to get you to see our own eye ophthalmologist, who used to be the ophthalmologist at the CAA and is also a pilot, for him to sign off any high refraction. And with the eyes and with the EU, they sometimes put different limitations on the certificate. So you may find for a UK medical, when you come in, you don't need to do anything. For the same medical for the EU, they may say you need to see an ophthalmologist each year. And there are very strange and differences between the two medicals, which take quite a lot of understanding. We understand it, but not all AMEs will understand it. So if you have any concerns about your colour vision or your eyes, you could have a standalone eye consultation with us. And if you had any worries about the colour vision, you can have a standalone CAD test. And this saves you paying for a full medical. So if there's any worry about your eye prescription, are you out of limits? If you've had laser surgery, we need to know about your prescription before you had the laser surgery, details of the surgery, and post-operative details. In terms of glasses and contact lenses, you need 2 pairs of glasses. If you've got distance glasses, you could have a prescription sunglasses made up, which would count as your second pair. Contact lenses are permitted, but you still need to carry a spare pair. And you need to be able to wear contact lenses full time before you're allowed to wear them in the aircraft. If you have any lens implants, monofocal lens implants are permitted by the UK, but they're not permitted by the EU. And we have had pilots who've had eye surgery who've come along and said, "Can I have my certificate back, please, doctor?" And we send it off to Austria and they say, "Sorry, no." And once you've had the lens implant in your eye, there's not much you can do about it. So you'll find on your certificate you might get one of these 5 limitations. There's a limitation for near vision, far vision, and various other conditions which I won't go into. With the ECGs, there are lots of variations of normal. Not everybody is the same shape and size. You get tall, slim people, and you get stocky people. And when we do the ECG, the EU and the UK have different interpretations and standards. There's a computer-read report on it, and if the computer says it's normal, that's fine. If it's abnormal, it's read by our cardiologist, and if it falls outside the parameters, he will then recommend further cardiology investigations. If you have a history of asthma, we will require a copy of your GP records, and you will also require exercise spirometry, which means you're running on a treadmill. You do the breathing test before you run on the treadmill, and then you do the breathing test after you run on the treadmill. And you'll need an assessment by a chest physician, and obviously this costs more. This is important because if you have a decompression at altitude or you have smoke in the cockpit, we need to know that your respiratory tract will cope with the situation and that your asthma is not going to take over and that you'll still be able to undertake the tasks required of you. If you have any history of anxiety or depression, and we find this quite commonly, that a lot of teenagers seem to have been given antidepressants for short periods of time, this triggers a mental health assessment, and we will require reports from you, and we would need to send you to our psychiatrist for an up-to-date report, and that would be referred in to the relevant authorities. So at the end of the medical, if your medical is fine, your certificate is issued. You need to sign it, check the limitations, and note that it's valid for 12 months. If it's not issued, we're either waiting for reports, or we're waiting for reports that we then send into either the UK or the EU state. Your ECG might need overreading, or you might need further investigations. Malta's been a bit funny, so I don't know if any of you are thinking of applying to Malta, but I've now sorted that one out, so they allow me to undertake the medicals for them and issue their certificates. So when you get your medical certificate, check all the details are correct, check it's signed by the doctor and it's signed by you, check the limitations are correct, either for near or distant vision, check the expiry date, and check the date for the next test. So if you're in your 20s, your next ECG, heart tracing, or next hearing test, audiogram will be in 5 years' time. And the other important thing is that you understand what your responsibilities are to the medical certificate if you have any medical issues or illnesses. So if you're deferred and we don't issue your medical, if we get satisfactory reports, in certain situations we can issue the certificate, in certain situations we have to send it in. The ones we send in to the authorities, they make the final decision, so it's not us making the decision. If it's an unsatisfactory report, we would send it in to the relevant authorities, and they may or may not ask for further information, and they may ask you to see in-house specialists, and they would make the final decision on your fitness. In some situations, the CAA will write to the applicant and say, I'm sorry, you can't have a Class 1 medical certificate. If that's the case, there is an appeals process which is on the CAA website which you can go through. The other important issue, and we do a lot of this, we see between the two practices, we're probably seeing about 5,000 pilots a year now, and that's going up. And one of the things the airlines like about Centreline is that we manage the sickness and illness of pilots quite effectively, and we can get them back in the air weeks or months sooner if they follow our processes. So if you become ill, you need to talk to the AME. The CAA won't speak to pilots about medical issues. And if you have any medical issues, it's your responsibility to discuss it with your aviation medical examiner. And each week I probably get a pilot who comes in and says, oh, I didn't think I needed to tell you. If you read the regulations, read the certificate, if there's any material change in your health whatsoever, or you start taking any medication whatsoever, you need to run it past your AME. And we get a lot of pilots phoning us up in Gatwick or London asking for advice. And if we say that's fine, that's fine. If we need to make you unfit, we'll make you unfit and tell you what to do, what reports are required. And then when we get those reports, most conditions we can make you fit again. Sometimes we have to discuss it with the relevant authorities. And just remember that the CAA and the EU have these non-disclosure teams. So if you have a medical issue that we discover or they discover that you haven't told us about, they are quite hot on getting their legal teams involved to sort it out. So if you're being treated for a medical condition or prescribed any medication that can preclude you from flying, or you think it might, you need to talk through with us. And sometimes it's not the illness that's the problem, it's the treatment. So if you have flu and you take night nurse, that's got a sedative in it, which could make you sleepy on the flight deck. And one of the things I've started doing since COVID, I've done a fair number of video consultations with pilots. I've had video consultations with pilots in France and Austria and Scotland, and that's acceptable, and I've managed to sort them out without them having to come and see me. Another important point is that we and the authorities recommend that you do not alter any of your medical treatment or undergo any surgical procedure in order to obtain a medical certificate. The investigation, management and treatment of your medical condition takes priority over the flying medical process. We do find sometimes people will be on have a medical condition and they're on some medication and they just stop it and say, I'm not on it anymore. So just a stepwise approach to your medical: check the website, book your medical, read the information, medical records, complete the online forms, come to London for an initial, book in good time, bring a book or a tablet to read. And finally, be organised, book early and get your information, be honest and be patient. It takes time to collate all the information and for the CAA and EU to review it. You're not their only concern. Thank you. I'm happy to take questions either here or at the end. And if you want to collect the handout, you're very welcome. And thank you for listening to me.